Common protozoal diseases found in our country and Punjab region are, let's discuss each one of them. The first disease to be discussed is theileriosis or bovine tropical theileria. This disease is caused by tick transmitted protozoa Theileria annulata, and the disease is very common in Punjab region, mostly affecting the calves of 3 months of age clinically, whereas adult animals they act as carriers of the disease. This disease can infect cattle, mostly exotic or crossbred cattle. Indigenous cattle is resistant to the disease. Further, other animals like sheep, goat, they can also be found infected with theileriosis. This disease is marked by signs of lymph node enlargement, anemia, weakness, and bronchopneumonia with the nasal discharge, decrease in milk yield, and high grade fever. What happens actually, when the tick, when it feeds upon the animal, it releases its sporozoids, which are the infective form of the protozoa. So these sporozoids, they undergo asexual reproduction to form the trophozoites, and then which further form the macro and the microschizonts. These schizonts, they go to the white blood cells of the animal. This is of characteristic importance because it is also helpful in diagnosing the diseases when they reaches the macrophages and macrophages on monocytes and lymphocytes. They cause enlargement of the lymph nodes, and from these WBCs the merozoites are released, which then go to the RBCs where they form pyroplasms. The pyroplasms are somewhat signet ring shape like this, and further when the tick feeds on the animal, it can suck up these merozoites where the sexual reproduction of the protozoa takes place, form the sporogony from sporozoites, and in this way the life cycle is completed inside the tick and the host. This disease is characterized by generalized lymph node enlargement, hemolytic anemia, feverish fever, and in calves nasal discharge, dyspnea, and pneumonia, and signs of pneumonia are also found. There are certain atypical forms of the disease also, like ocular form where there is conjunctivitis and edema of cornea. Cerebral form is also there, ataxia, circling movements, and skin dermatological form also. However, they are not so common as the generalized form. Now, a diagnosis, we can do FNAC of the lymph nodes, we can do blood smear examination and clinical signs, and serological testing can be done for the diagnosis. In the necropsy, there is pathognomic punched out ulcer in abomasum of the calf. It is mostly found. Further, lymph node enlargement, splenomegaly, and pulmonary edema due to the bronchopneumonia is also there. Now, differentials, we should differentiate from babesiosis. Other protozoal diseases like babesiosis, anaplasmosis, trypanosomiasis, and malignant catarrh fever. In all these diseases, lymph node enlargement is not present. In malignant catarrh fever, there is ocular discharge, but no lymph node involvement is there. Treatment wise, buparvaquinone 2.5 mg per kg, single or 2 to 3 injections on alternate days can be done. Further, as it is always said that prevention is better than cure, so we should avoid the disease to happen by control of the ticks. Tick control should be done by using several acaricides such as deltamethrin, cypermethrin, malathion. We should use these acaricides on the animal itself and in the cracks and crevices. Further, we should care about tick vector mostly in the monsoon seasons, because like from July to September, when there is high temperature, high humidity, because these organisms are more commonly active during this period. Next important protozoal disease of clinical importance is babesiosis, also known as pyroplasmosis, Texas fever, red water fever, which is another hemoprotozoan disease characterized by intravascular hemolysis resulting in hemoglobinuria, hemoglobinemia, and severe anemia and jaundice. There are two forms, the large and the small protozoa forms, infecting almost all the animals of livestock like cattle, buffalo, sheep, goat, equine, canine species, and pigs also. And further, the pyroplasms can be the pyroplasms are found mostly in the RBCs, where they occur in pairs. They can occur in either acute form or the obtuse form. The species of protozoa which is of clinical importance are Babesia bigemini in ruminant cattle and Babesia gibsoni in canine species, Babesia equi in horses. These are also triatic transmitted protozoa. When the protozoa it feeds on the animal, it releases its sporozoites, which then form trophozoites or merozoites, also known as pyroplasm. The merozoites infect the RBC, and from these RBCs the merozoites are released, which are again picked up by the tick, and it completes its sexual reproduction inside the tick, where it is found in the salivary gland of the tick. So in this way the cycle is completed. Now what happens actually when the pyroplasm they infect the RBC, they activate the lipid peroxidation inside the RBCs, resulting in lysis of the RBCs. So there is severe intravascular hemolysis is there, and we all know when there is intravascular hemolysis, those ruptured RBC along with the hemoglobin, they come out through the various through the urine, so resulting in red colored urine and sometimes of chocolate colored urine also, and it results in severe anemia, decreased HB of the patient, decreasing PCV, packed cell volume of the patient, so and weakness, abrupt weakness, high grade fever, and almost animals of all the ages are susceptible to the babesiosis, and if the animal recovers, they become the carriers of the disease, because it has been found that on clinically that even in spite of treating the animal, now they have started becoming resistant to various drugs also, and if they get treated also, but they still act as a carrier. However, the incidence of the disease in adult animals becomes less as compared to the young animals. In equines, Babesia equi is mostly found, and in equines it does not causes hemoglobinuria. This is the classical feature of Babesia equi in equine species, but other signs such as recumbency, and fever, jaundice, severe icterus, and high grade fever. These are some of the signs which are found in the equine species. In equine species, it is the cases, the infectious diseases resulting in jaundice and high with fever are only 1 to 2 diseases which are mostly found in our country, like equine infectious anemia and equine viral arthritis. So these are the two main differentials for the equine species if they are found with the if they are found with the signs such as fever and jaundice and other signs of anemia on blood examination. Further, in canine species, hemoglobinuria is found. There is severe jaundice may be there, and HB and PCV fall with fever and anorexia. These are some of the signs of the these are again the very common signs of babesiosis in canine species also. And treatment wise, diaminoxine acetate, Baranil, it should be given at 8 to 16 milligram per kg dose rate, one or on alternate day, at least 2 to 3, and imidocarb for 1 to 2 milligram per kg as prophylaxis and therapeutic also can be given. Third and for most important disease, hemoprotozoal disease of animals is anaplasmosis, also known as gall sickness. This disease is caused by protozoa Anaplasma marginale in our country and is very common in Punjab. It can occur as it is mostly sporadic, but can occur as an enzootic also, mostly in the weather when there is high humidity and high temperature, like for example from July to September. This disease is transmitted by ticks, flies, and also through infected needles which are being used by like quacks if they use the same needle on the of infected animal on multiple animals. Fly act as a mechanical vector only, whereas ticks such as Boophilus, it can transmit the disease. Anaplasma marginale, it infects mostly the RBCs of the animal. When it infects the RBCs, it undergoes binary fission over the RBC and then keeps on dividing and infects multiple cells of the body. Now when the RBC is infected with some organism, now this is not a normal RBC, and the reticuloendothelial system of our body will consider it as an abnormal RBC, so definitely it will tend to lyse this RBC. And such type of lysis occurs mostly in the spleen. So this is also known as extravascular hemolysis. And whenever there is extravascular hemolysis, there is release of bilirubin, okay, from the RBC on lysis, and this keeps on happening in mostly spleen. So splenomegaly is one of the consistent finding. Further, jaundice is there. Jaundice is there because when spleen is not able to perform its function, the released bilirubin will not be picked up for the formation of RBC. So jaundice is a consistent finding of anaplasmosis, and in goats the only subclinical forms have been found. Signs such as high grade fever, decreased hemoglobin, decreased hematocrit. These are some of the signs of anaplasmosis. And treatment wise, tetracyclines 11 mg per kg, body weight, IV or deep IV, at least for 5 days, or long acting oxytetracycline at 20 mg per kg, or after every 3 days apart, at least 2 to 3 doses. But the animals infected or recovered from the anaplasmosis become carrier of the diseases and can be activated whenever there is an environment of stress or like high temperature, high humidity. So environment control, temperature, humidity, and vector control, these are important tools and important steps we should keep in mind while controlling a disease over a particular farm.